Most people are really friendly, and they're usually curious because they're like, so are you a nurse? Are you a doctor? Because, you know, if you wear a coat or something, they're like, if you have a coat and a name badge, you can get in anywhere.
Well, the program's been in existence for almost 10 years, and it's primarily to help out when we're short-staffed with nurses being out sick or on vacation, but the biggest part of the program is to give students, UT students, experience in a clinical area.
I started out as a poli-sci and helped with research on the North American Free Trade Alliance, and I was researching the social implications of it. I kind of got fixated on the health problems. All right, if you could go ahead, open your mouth, raise your tongue, please. I take the charts and I room the patients, take their vital signs. If they need, I'll take their oxygen saturation level or their peak flow. Just really basic stuff like that. I was always kind of worried about how I would interact with patients, and this has definitely given me the practice that I needed.
Freshman year I was in a FIG, and my FIG mentor was applying, and she was applying for a position to volunteer, and she actually kind of repped it to us, but I don't know. I get kind of frustrated because I work at the health department right now on tuberculosis, and it's frustrating to only be able to do the statistics side of it and not actually be able to treat people. But then, you know, you work here and you get to talk to people and you meet with them day to day, and you just, I don't know, I enjoy the people side of things and actually meeting people. And
blow it as hard and quickly as you can. Like you're blowing a bug off your shoulder, but imagine.
You know, it's actually been very positive because students will open up to their peers a lot more than they will to an adult and an older person sometimes.
It's great exposure, and it's not just filing paperwork somewhere in a hospital or just moving patients around. You're actually doing stuff.
Well, I hope to work here till I go into medical school. I'm looking at getting my phlebotomist certification so I can get paid for my for my work at the blood center. Stick people with needles, basically. Take blood. Yeah, any wound care or minor surgery. I get really excited. Thank you. When I first started coming here, I had a problem with fainting, to be quite honest. And I thought it would be a real problem with the staff, but they were actually really helpful and just kind of worked through it.
Yeah. Hanging out with the doctors and the nurses, it's really enlightening. You've got people that have been working in medicine for, 40, 50 years, so there's a lot of insight and experience that you can't figure out on your own. It's definitely made me realize that it's not worth doing something if you're not going to be happy, so you should really just take your time to figure that out. And I have become a little more dedicated to actually getting there and doing medicine.